right after I got accepted into medical school, my dad got diagnosed with cancer. And I was shadowing a radiologist and a cardiothoracic surgeon, and I was leaning more towards something like that. And then he got cancer, and it kind of rocked our world because nobody had ever really been like really sick before. And he's fine now, he's doing great. But it really shifted my focus about like what's important in life. And going through med school, then I paid a lot more attention. I was more interested in the oncology courses, and just having that experience really made me a lot more interested in oncology and providing the care that my dad got and being able to do that for people now. A medical oncologist is the first person that you generally meet when you get diagnosed with cancer. We are the people who treat your cancer with what we call systemic therapy, which is either chemotherapy or immunotherapy. Sometimes you might get a targeted therapy or a pill, and we administer those therapies. So there are radiation oncologists and interventional radiologists, and they do more localized treatments, but we treat cancer throughout your whole body. We also are the people who oftentimes provide a lot of emotional support. We can be your sounding board, and we're there for you throughout the entire process. And then after you're done with your treatment, you also follow up with us. We manage any of the side effects that you're having going through a treatment. And we also help take care of the caretakers who are taking care of you as well. There are other facets to treating a cancer patient. And so just in our clinic alone, like we have a social worker, we have a dietitian. A lot of people will need support as they don't have a great appetite, or they're having some nausea or weight loss as they're going through their treatments. Sometimes people need a feeding tube depending on the type of treatment that they're getting. And so our dietitian is really helpful with that. We have access to the VNA, of course. The VNA provides a lot of care at home. There's palliative care services, which is when you're going through treatment, you're going through active treatment, but you just need some extra support. There is the Living Fit For You program, which is physical therapy designed for cancer patients. I am at 100% in terms of patients giving me feedback that helped them. So I will continue that streak. There's also the Cape Wellness Collaborative, which is really great and provides a lot of support and services for a lot of the side effects that people are going through. So a lot of the treatments that I give maybe cause nausea or neuropathy, which is numbness and tingling on your fingers or toes. Generally, that's where it starts. And I can give medications for that, but sometimes people want alternative therapies like acupuncture, massage, Reiki therapy, things like that the Cape Wellness Collaborative can offer. And I think those services are amazing, probably underutilized. And I always try to remember to talk to patients about those access to those services as well. I think there's probably not like one overarching thing that guides me, but there are some principles that I try to keep in mind every day, and especially the first time that I'm meeting a patient. And I try to put myself in their shoes. It's the most stressful time of their lives for most people. A lot of people have Googled and maybe don't have the right information or are thinking worst case scenario. So I try to remember, like I said, to put myself in their shoes and approach the situation and approach them with a lot of empathy, a lot of kindness and respect. And I try to get to know the person who's sitting in front of me, because, the way that we approach oncology a lot of times is there's an algorithm and this is the treatment that we do. And if this doesn't work, these are the next ones. But every person sitting in the chair in front of me is unique and special and different. And I really try to get to know them as a person and make a mutual decision, a shared decision about what treatment and what approach is best for them. I think everybody goes into medicine because they want to help people. And of course, seeing somebody have a good response to the treatment, of course, that's what you want to see. But for me, I think the most rewarding thing is the relationships that I have with the patients. Like I said, you're starting meeting them at a very scary time. And I like to provide as much information as I can for them. I think, of course, knowledge is power, and a lot of people want to know exactly what's going on with them. And I like to provide that as much as I can without overwhelming. And I frequently check in those first visits, make sure I'm not overwhelming people, because it can be a lot. But as you progress through the treatment with a patient and you go through the struggles with them, and you hope that you're going to be able to, hopefully there's a situation you can cure the patient, getting that first set of scans or imaging when you're seeing good results is one of the best parts of my job. Things that I've learned from my patients in particular is really just still living your life. I have many patients who always ask, can I take a week off of treatment to go on this trip or go see my family member? And they don't let the diagnosis that they have interfere with their life and slow them down. And then they come back from their cruise or their European trip or their trip to see their family across the country, and it rejuvenates them and they're ready to keep moving forward with treatment. What I do for fun mostly is hang out with my kids. That takes up a good deal of my time. I have 2 toddlers. But what I do outside of that is I have taken up running. I always kind of sporadically ran throughout my life, and I've always wanted to be able to run a half marathon. So last year I really committed to it. I did many runs along the canal. I find that to be very relaxing. And I was able to run 4 half marathons last summer. So now it's time, now that winter's kind of getting over, it's time to get back into that again.